Hey guys, let's talk about development of interatrial septum. So see here, this is right atrium, this is left atrium. We'll see this whole diagram here in a zoomed way. So in between the atria and ventricle there is endocardial cushion. This is endocardial cushion. So first of all we'll talk about formation of septum primum. You can see here this is septum primum. Okay, let's talk about the formation of septum primum. So a thin crescent shaped tissue called septum primum grows downwards like this. It grows downwards like this from the roof of the common atrium towards the endocardial cushion. Okay, so a thin crescent shaped tissue called septum primum grows downwards from the roof of common atrium towards the endocardial cushion. The gap between the lower edge of the septum primum, this is lower edge of septum primum. So the gap between the lower edge of septum primum and endocardial cushion is called foramen primum. This space is foramen primum. Now we'll talk about formation of foramen secundum. This is foramen primum. Then where is foramen secundum? Now, before the septum primum, before this septum primum completely fuses with the endocardial cushion, apoptosis will happen. Apoptosis means cell death. So cell death happens, creating a new perforation in the upper part of septum primum. Like you can see here. The cell death, apoptosis happens to create a new perforation in the upper part of septum primum. These perforations coalesce to form the foramen secundum. This is foramen secundum. Now the septum primum went and attached to the endocardial cushion, go down and attach it to the endocardial cushion, making a apoptosis here, cell death, to create a new perforation in the upper part of the septum primum, making it foramen. This perforation coalesce to form foramen secundum. The foramen secundum ensures blood flow between the two atria during the fetal life. This foramen secundum ensures blood flow between the two atria, right atria and left atria, during the fetal life. Now we'll talk about formation of septum secundum. This blue color one is septum secundum. Okay, a thicker and more muscular septum secundum develops to the right of the septum primum. To the right of the septum primum, it formed septum secundum formed. It grows downwards, but it does not completely fuse with ECC like septum primum. Septum primum went to meet fused with ECC, right? But septum secundum does not. It does not go downward and completely fuse with ECC. It leave an opening called foramen ovale. This is foramen ovale. This is foramen secundum in septum primum. This is foramen ovale in septum secundum. Now, we'll talk about the fetal circulation via foramen ovale. So the foramen ovale, allows oxygen-rich blood from the right atrium to bypass the non-functional fetal lungs. In fetus, lungs are non-functional. So to bypass that, the foramen ovale, what foramen ovale do to bypass that? It allows oxygen-rich blood from right atrium directly enters the left atrium. And during development, pressure in right atrium is more. So blood automatically moves from right atrium to the left atrium. And now we'll talk about after birth. You see here, this is now interatrial septum is formed before birth, and during the development, the blood is shunting from right atrium to left atrium via foramen ovale. So after the birth, what will happen? At birth, when the baby takes its first breath, pulmonary circulation starts. Increased pressure in it leads to, when the pulmonary circulation starts, it increases the pressure in the left atrium, causes the septum primum to be pushed against the septum secundum. Again, I am repeating it again. So at birth, when the baby takes its first breath, pulmonary circulation starts. So when pulmonary circulation starts, it leads to increased pressure in the left atrium, which causes the septum primum, which causes the septum, this is septum primum, which causes the septum primum to be pushed against the septum secundum. So this pushed against like this and functionally closing the foramen ovale. So this leads to functionally closing the foramen ovale. How the foramen ovale is closed here? So at birth, when the baby takes its first breath, pulmonary circulation starts. So when the pulmonary circulation starts, it increases the pressure in the left atrium. It increases pressure in the left atrium. It causes the septum primum. I'll draw it here for you. Septum primum to be pushed against septum secundum. So it will be like this. It is pushed against septum secundum due to high pressure. So this, what it will do, this functionally closing the foramen ovale. So over time, the two septa fuse completely. So over time, what will happen? This septa and where is blue? Yeah, this septa and this septa fuses completely. It fuses completely to form fossa ovalis. After these two fuses completely, it forms the fossa ovalis. This is fossa ovalis. Fossa ovalis. Fossa ovalis is a depression seen in the adult right atrium. So this is floor of fossa ovalis is formed by septum primum. This floor of the fossa ovalis is formed by septum primum. And margin, this is margin, the upper one, like this is margin, this is margin. So the margin of the fossa ovalis, we also call the margin of the fossa ovalis as limbus fossa ovalis. So the limbus fossa ovalis is formed by septum secundum. Floor of the fossa ovalis is formed by septum primum. Margin of the or limbus of the fossa ovalis is formed by septum secundum. So this is depression. I can show you here. So this depression is fossa ovalis. This margin is limbus fossa ovalis. I think it's clear for everyone, right? Okay, I will talk about the clinical correlation in a separate video, so that with example of a case also. Okay, so I think it's good. I think it's clear for everyone. Okay. Okay, next we will talk about the development of interventricular septum. All right. So thanks for listening. Thank you.